Thanks.
Okay, my first question is just for like students who are unaware, like what exactly is healthcare for all, and how would it be different from like the current healthcare system we have in the United States?
Well, Healthcare for All is a nonprofit advocacy organization, and we work to educate Marylanders about feasible, cost-effective ways to expand access to health insurance. So we have a specific Healthcare for All plan that was released in November 2008 that utilizes a lot of the ideas that Massachusetts used to expand access to health insurance by creating a pool for individuals and small businesses. We also create a statewide catastrophic reinsurance program, and without getting too nitty-gritty, just using a lot of the things that are already in place in Maryland and maximizing the benefit of that so that everyone has an affordable, quality option. And not necessarily creating socialized medicine, but really looking at what we all value and expanding it so that everyone can, buy in.
Okay. I think that kind of, my second question was going to be, what is your goal or mission? But just to make healthcare like more affordable, or so that more people can have access to it.
Right, and that involves both working on the advocacy side and promoting policies that expand access to health insurance, but then also educating folks about what's available. For example, they just passed a law that expanded Medicaid eligibility, so that it's called the Working Families and Small Business Health Coverage Act. In 2007, it passed during the special session, but everyone was talking about slots. So this is a great program that a lot of people can benefit from, but they don't know about. About 100,000 Marylanders now qualify for subsidized coverage. Be that through a grant program that they set up for small businesses or through the Medicaid program called Medical Assistance for Families. And we've been really, making sure that all of the members of our Healthcare for All coalition, of which there originally were 1,100 organizations from across the state, found out about it, know how to enroll, and know how to enroll their neighbors. We've been going to health fairs, outreach events, churches, everywhere.
Motor Vehicle Administration.
Motor Vehicle Administration, where people have lots of free time. So it's definitely a two-pronged approach, and we can use volunteers both in working in the advocacy operations and the outreach as well. So if there are people who are more interested in policy, we've got a place for them. If there are people who are more interested in that exchange and that social support, we've got opportunities for that as well.